You're watching a special edition of Medical News Network, your trusted source for the latest in medical news and information. I'm Mike Wiggenstein, and thanks for joining us. We brought our cameras here on location to the beautiful Dental Implant Institute of Las Vegas to find out just what goes on every day inside this incredible facility with its president, co-founder, and Las Vegas's leading lady of dentistry, Dr. Jennifer Cha. So sit back, relax, and get comfortable, and I'll see you inside.
Welcome to an educational and comprehensive discussion with today's top medical experts. Your trusted source for the latest in medical news and information. You're watching Medical News Network.
Welcome back. We're standing in the lobby of the Dental Implant Institute of Las Vegas, waiting for the co-founder and president, Dr. Jennifer Cha, to give us a tour of this beautiful facility to see just what goes on here every day.
Hey, Mike, you're here.
Hi,
Welcome.
Doc. Very nice to see you. Thank you for inviting us out today.
Thank you.
I know you told me that today you're going to allow me to have access to your patients and to your staff and to give me a tour of the facility. But before we get into that, tell me a little bit about the facility. Where the design came from? Is there anything special that you guys did when you had in mind when you designed it?
Well, you know, everybody think it's me that designed it, but
I would, looking around, think it was you.
no, it's Leon. He's got the artistic image, and he's got this vision in his mind, and he just like silently does everything. Every accessory that you see here, it's patiently put by himself in each location. The color scheme, the art that he chose, it's all his doing.
Now, is there an idea to design? Was it designed to make people, more comfortable, to make it soothing? Is it, that feng shui we hear about?
Well, you never know what's in his mind, but only thing I know is coming from the patient's comments is like, wow, whoever decorator that you picked, it's very, very soothing. I feel like this is a great home, that I feel comfortable, and it doesn't feel like a dental office.
It doesn't. I want to tell you, when I came in today, I was kind of impressed by the colors and the feel and the staff. Mm-hmm. Now, you're going to let me, it's my understanding, you're going to allow me today to speak to the patients after you've done the surgeries, because I came today because over the last year, since I interviewed you last, I've received tons of emails and letters talking about what goes on here. And I've had people actually tell me that they've come here in the morning, first time, showed up, had implants done that day, drove themselves home by noon, and everything was fine. Now, are you going to allow me to have access to those people?
Well, these patients do not know that they're going to be interviewed at all, so you have to ask, but I will certainly ask first.
Okay.
And if they said yes, then I will let you go ahead and talk to them. But, you have to excuse me because we're kind of have a busy schedule, and
I understand.
I
will
have
work
to
around
tend
your
to
schedule.
Thank you.
Okay, now you have this office, and then you have an office in
Henderson.
that is a satellite of this one. Do you do the same things there?
Same things. Actually, the Henderson office is more nicely decorated. The color scheme over there is blue and yellow and red chairs, and it's two different flair. But everybody likes it over there too.
Okay, well we're gonna go see the institute here. I'm gonna get to meet some people, so please take me on a little tour.
Come on in.
All right.
I apologize that I talk funny. I just had my implant done 5 minutes ago, and I have 3 of them done. First of all, I have my front teeth. I have a crooked teeth, and having problem with periodontal problem. It's hard to have braces. So I have 1 pulled teeth out and put the implant in. Yeah, today's the first day, and everything was done today. No, I was surprised though. I just came in for consultation, and it was done in I don't know how many, few minutes. They're very professional. Dr. Chen and Dr. Cha, they're so great. They're good, very gentle. Highly recommended this place.
Come on in, Mike. This is our reception area.
Okay.
And Marcia?
Hello,
This is
Marcia.
Mike.
Mike, it's nice to meet you.
Very nice to meet you. Tell me what you do here at the institute. Somebody comes in, do they meet you?
Yes, they do. They meet me. I have the opportunity to actually be the first impression they have of this office.
Now,
And
how long have you worked here?
I've worked here about 4 years now.
Yeah, and what do you enjoy the most about your interaction with the patients?
It's actually meeting the patients. I like to try and make them feel comfortable, because actually nobody likes to go to the dentist. So if you make them feel comfortable, then it kind of eases them a little bit. towards their treatment and what they're going to have done.
Okay, do you help with the scheduling of patients? If
Yes.
somebody called here, would they talk to you?
Yes, they'll talk to me and the rest of us up here at the front desk.
Well, thank you very much. All
Thank
right.
you.
Thank you.
Nice to meet you.
She seemed very nice.
I had some bone loss. I had a tooth that's been loose for quite some time. It's been wearing down, and eventually it got to the point where it had to be extracted. And subsequent to that, I made a decision to get an implant. Oh, I've known Jennifer and Dr. Cha and Chen for a long time, and I trust them and I know them very well, and they have a really good reputation. Oh, I sell insurance and securities, financial advisor, so to speak, or planner, and in my business, my smile is very important. No, it was not that painful at all. What I'm doing is that after they do this one, then we're going to go to have a tooth in the back that had been extracted some years ago, and the sinus has dropped, and Dr. Chen's going to go in and he's going to lift that so that it's in the right position, I guess, and then put in another tooth, because as time goes on, the bottom tooth below it, it'll impact that as well. This whole process has only taken about 3 months from the initial extraction, preparation of the tooth or the implant till now. I've heard from other people, you know, you hear things in rumors and you don't quite know what to do, but I trust Dr. Chen and Shaw implicitly, and they did a great job.
And this is where we check out, and this is Michelle.
Hi, Michelle. Now, so the people are done, and they go to leave, they come and see you, and you help them with their financial arrangements?
Yes.
And tell me, how long have you been with the Institute?
Just a few months. I'm a new addition.
Oh yeah? Do you like it?
I love it here. It's great.
Okay, tell me what you enjoy most about your interaction with the patients. Do you help them with everything they need?
Yes. From when they check in to check out, I also help seat them in the back sometimes.
And are you available if they call during the day, if they have questions or concerns?
Yes.
All right. And what's your favorite part of the Institute? Is it the art? Is it the colors? Is it the people?
Well, it's mostly the people. We have a really great team here.
And you lied to me. You told me earlier it was lunch, and I was going to call you on that. My favorite thing, too. It's been a pleasure meeting you. We're going to continue our tour. Thank you.
Thank you.
That's good.
Yeah, well, recently my teeth had been grinding and they've been chipping away. I got concerned about it, so I began to look to see about going to a dentist. I'm newly arrived here. I've been here about 5 years. And as I'm passing through the facility here, I noticed the implant thing. And I had read something about it previously, about 9 years ago when I lived in Hawaii. And so I stopped in to see what was going on. I had called and made an appointment, actually. And they had set one up, and I just got off work this morning and came straight here. And as we were talking and as we were looking at the images on the screen, he started telling me about what needed to be done. My first concern was whether I could afford it. Found out I could, so I said, let's do it. And I had those 3 implants done today.
Well, you have 2 infected teeth, and it's a second molar and a wisdom tooth on the upper left. And also he had 2 missing teeth previously back in Hawaii. He never had anything done there. So what I did is I proposed that he needs 3 implants, 3 missing teeth. We don't include wisdom tooth as an implant. It has a huge infection on the upper left already communicating into the sinus. And he does have a little sinus problem in the morning, but he didn't know it was tooth related. But after looking at the x-ray and I explained to him the infection already traveled all the way to the sinus floor, that more likely that's where the cause of the sinus infection. So I mentioned to him he needs also a sinus graft on top of the implants. And after I talked to him, he decided to do it today. And I just described to him how simple and the procedure can be done within short of, probably 40 minutes total. And so he decided that that's the way to do it right now, because he will not allow the infection to spread any further. The implants is placed, and we just had to wait about 4 to 5 months. The other 2 implants actually can be ready to restore in 3 months, but the upper left, where we did the sinus and bone graft and the implants simultaneously, due to so much bone loss and so big of a void that we had to fill in. Looks like we probably need to wait about 5 to 6 months to get it done. Well, traditionally, that's what most of people it's been invented back in 1977, is what we call a window technique. What that means is you have to infracture the skull base to add a bone into the sinus floor. You waited 6 months and you place implants after that. But in his case, we had to take the tooth out so you had to extract the tooth, let it heal, fill the bone with a socket, let it heal, sinus graft, that would be in the hospital setting, let it heal. So total already about 1.5 years before you place the implant. And after you place the implant, you need to wait 4 more months. So by the time he really able to chew and restore that crown, takes about 2 years. What I did is I went ahead, I feel there must be an easier way to do it. So what I did is throughout many years of experience and tried to figure out how to elevate that sinus floor, I was able to invent a way to introducing a water pressure. The water pressure will loose up the sinus membrane. And at the same time, there's a little condenser that I can push the synthetic bone into the sinus floor, and all can be done within 15 minutes.
When I used to go to my dentist here every 6 months, 10 years ago he had gone to a seminar to learn how to do implants. He suggested that I should try one. And I was kind of reluctant because I said, well, you're just learning. I don't think I want to be your specimen here. And I just happened to leave the area and come to Las Vegas. I saw my teeth being chipped away slowly, and I says, I better start doing something about it. And I feel like I want to be able to chew my own food until I'm ready to die. I mean, I don't want it ground up in some blender and suck it out with a straw. Well, one of the things that they put you at ease, or doctor put me at ease, and the procedure was so non-invasive. There was no pain, I didn't even taste any blood, which is one of the things that amazed me. And there was no spittoon for me to be spitting anything out. I thought, this is totally, totally new procedures and new technology. Take advantage of it. It's here. None of them, in fact, none of them were, let's do it, and pushy. They were just telling me, and then they'd leave and let me make up my own mind.
Normally, a lot of people usually gets a couple interviews with different other doctors, and they hear different techniques, and by the time they get here, they kind of make up their mind. But these are very typical patients that decide to have implants at the same time, have a sinus lipo at the same time, yes.
So Mike, these are the surgical operatories, and this is where we perform surgeries daily.
Now you seem to have, you have some operatory rooms over there and then some over here. By the way, how big is this building?
The building's about 9,000 square foot.
That's
sitting on 2 acres.
Okay. Why do you break the rooms up like that? There seem to be some more open ones here. These have doors.
Right. These have a little bit more privacy because this is where I like to perform surgeries, and they're a little bigger because sometimes when we hire medical anesthesiologists, they bring in their equipment and we need to have a little bit more room for
so
equipment.
You've actually, if people, and I haven't seen in any of the surgeries I've watched with you, but you actually, if people have anxiety, if they want to be out for the surgery,
right. A lot
you
of
have
times,
the ability to bring it in.
It's all in here.
Right.
And we explain to them that it's really no big deal. It's going to only take about an hour, hour and a half at the most, but they have a pre-existing trauma from another place where they want to be put out. So if they request, we hire a MD anesthesiologist to come in and make sure that they're safe. And that's why we have these rooms to be a little bit bigger. They're all plumbed for nitrous and oxygen. And that's why we are able to...
I did notice, because you talked about it's all up here, it's all
Yeah.
in the head. And some of the people, obviously, that we've talked to today, and hopefully more I'm going to talk to, all tell me about the same thing, that they were nervous, that they were concerned, but then when they came in, you guys have a real easy and nice way of basically making it seem not like such a big deal. And obviously for you it isn't.
Yeah,
I've seen more implants put in one day than I've seen it most places in a year, but
Right.
is that something that over time, because you do focus purely on, mostly on implants, is that something that over time you've come to a spot where you know what makes people comfortable because you do so many?
Well, a lot of times I think that patients' fear is kind of energy that you kind of get from the doctor as well. So if patients feel that we're confident, we're comfortable, we know what we're doing, because this is what we do every day, so they feel like, okay, I mean, the doctor seems confident, they seem like they know what they're doing, and obviously our records have shown that we have a lot of successful cases, happy patients, and they just take on that energy.
I came to this country from Kiev, which is Ukraine, and which is very close to Chernobyl. Everyone knows what Chernobyl was and is. It's a disaster. And I was affected by this event, terrible explosion. And I lost my bones, and my gums became mushy, and my teeth started coming out like a mushroom from the ground. And it means I lost my teeth. I was in trouble, and I came to this institute. I met Dr. Chen and Dr. Chang, and I think it's God just sent me these miracle people. They so skilled, talented, and wonderful people. They saved me. They implanted new teeth for me. When I came to America, it was 11 years ago, it started coming like this teeth. I lost teeth. I pushed teeth and it's came off. When they organized here conference.
Seminar.
Okay. Seminar, I visited 2 times. Seminar, when I start talking to them, they start talking to me. Because I trusted these people. I learned about their experience, about their history of their work. And when I talk to them, I feel very comfortable talking to them. They like their voices, their manner of talking, their manner of smiling, everything persuade me to do this here. And then I feel very say now that I did right way.
Well, she had advanced periodontal disease. She had no bone at all. She asked us to place some implants, and especially in the front, because front was a major concern for her. Of course, she liked to smile, and she liked to look good, but there was not much to work with. It's like a really, really paper-thin ridge. It was probably one of the most difficult cases that we were able to. My husband actually placed implant and grafted a lot of bone at the same time. And in the beginning, it was just the 6 front teeth, and then she kept coming back, I want more here so I can have a little bit more back teeth, and can I get a little bit more back there? I said, okay. So she was a very compliant patient. She followed all the instructions that we told her. And it took it's a challenge to make her teeth that what she has now, but I am very, very grateful that she's happy, she looks great, and she smiles more. And when she first got her teeth, she was still talking with her tongue in the roof of her mouth because she got so used to talking with that partial that kept coming down during all those years, that even though she had permanent bridges in the front, she kept talking like holding her palate with her tongue at the same time. So I had to tell her, come on, talk normal now, because you don't have anything that's gonna fall down anymore. It's in there permanently, so just be relaxed and just talk normal. And it took a couple months for her to get used to being able to talk without having to worry about it's gonna fall down on her. I would say she would have been turned down by a lot of dentists because she had no bone to work with. I think that incident in Ukraine really did a number on her physically. But it's been more than 10 years after that incident. Actually, in the beginning, she was kind of concerned that if she's going to have a normal type of healing, or we weren't even sure what the side effect is going to be after that kind of nuclear exposure. And we were kind of concerned her healing ability. But she healed very well, and she followed instructions, and now she's happy.
I'm happy. I'm not thinking about implants. I feel like I have natural. I was born with this teeth, I eat food and apples, hot stuff. Yeah, apples I used to No, I was eating, but I sliced them, you know. Now I'm just biting. No, I'm not thinking about my teeth, I'm thinking about food and company. I was very nervous, I was very afraid. I just was afraid, like, oh, afraid. All right, but I said, I have to do this, and if I die, it's all right. And doctor was very nice, no pain at all, no pain. One surgery, then waiting time, then installation. I just called all the time here, and doctor asked me how I'm feeling. I said, I'm feeling all right. I didn't have problem. I didn't complain because everything was done perfectly. And I feel and felt very comfortable.
I think she came more to make the teeth because I wanted to make sure that it looked perfect on her. Yeah. I wanted to make sure, because I always get this picture in my mind, what I want the finished product to look on each patient. Sort of like a fitting for a custom dress. This is a fitting for size of the teeth and the length of the teeth that would fit her face. People trust in us to give them what they hope for all their life. Actually, a lot of people say that my teeth look better after implants than the one they had before.
What's happened to me? Yeah. And I want to say, after surgery, I did not use this painkiller. I did not.
Because you're tough.
Yeah, no, I just used 3 pills of aspirin that make me like sedative for me, and I fell asleep. And in a day, no pain at all.
But you're tough and you don't even know it.
Oh, thank you. No, not really. It's the truth. Oh, emotionally. I became more emotionally, you know, like free. Can I say this? Emotionally free? Happy. Thank you, doctor. All the time saying, thank you, doctor.
Thank you.
Oh, they're so sweet. They're so smart. They're so skilled. They're so talented. I don't know what to say else. They just, what? God blessed them and gave them talent. And now they're giving their skills to people. Thank you, God, for both of them.
Thank you.